Hi, my name is Brittany Jackson. I'm term 2 and this is Piggyback administration. I'm going to start by reading my doctor's orders and looking at the MAR. He's ordered Flagyl via IV, 500 milligrams every 6 hours. And I'm going to look at my Flagyl, and it's 500 milligrams per milliliter, so I know I'm going to give 1 ml. I'm going to determine the drip rate. It's 10 drops per milliliter, so that would equal out to 17 drops per minute. I'm going to start by performing hand hygiene, and I'm going to pull up my Flagyl. And I'm going to switch the needle out and inject my bag. Sharps container. Mix my medication up. Label the bag with the client's name, my initials, the drug name, the dose, and the time. And I've got that ready. Now I'm going to prime the line, open this up. These are both sterile, so I don't need to clean them. Fill that up about halfway. Unclamp. Reclamp. And I'm ready to go to my patient's room. Alright. I'm going to introduce myself, perform hand hygiene. I'm going to go ahead and put on my gloves. I'm going to explain the procedure to the patient that we're going to be putting on a Piggyback, the Flagyl for their infection. And I'm going to identify the patient with 2 identifiers, their name and their date of birth, and check it with their ID band. And I'm going to assess the site for any tenderness and pain. Okay, and make sure this is flowing okay, and it is. And I'm going to attach the secondary bag. Well, I'm going to hang the primary lower and clamp it off. That's clamped off. Hang this one higher. Clean that cord off. Make sure this is clamped off. Okay, now I'm going to unclamp, and I'm going to determine my drip factor, so make sure it's 17 drops a minute. Okay, reassess the site, make sure it's flowing in okay, make sure that's clamped, we're good. All right, now I would leave the room, take off my gloves, And I'd come back later, redo hand hygiene, put back on my gloves, see that the medication's done.
Excuse me, I'm sorry. That's why I always ask that you tape in another room.
I would reassess the site and see that it's okay, no redness or tenderness, and I would clamp this off, and I'm going to leave that attached, and unclamp the primary. It's unclamped. Reestablish the drip factor on the primary. Make sure that's going in okay. Make sure the patient's not in any pain. And the only thing I forgot is to ask the patient about allergies. I should have asked if they had any allergies, and that's it. And I would document as well. I would document the use of the MAR, the time, the drug, the dose, the route, the condition of the IV site, and the amount of fluid that was put in the patient. And that's it.